Good evening, everyone. Dr. Christine Smith here with a fun guest for you today who has actually been on my channel before. So I'm going to go ahead and invite him, Dr. Jared Ward. And he is a fellow chiropractor and practitioner of applied kinesiology. And applied kinesiology is a really cool way to approach and you can almost treat the body like a circuit board, and that's kind of how I explain it to clients. We are essentially using the muscles as an indicator of when the system is stressed or when something is actually beneficial for it. And this dives into a whole history of different ways that it's been used, and it is used for allergy testing and a whole bunch of different things. So you can even use it for injuries. You can use it for metabolic stuff. One of the ways that I use it in my office is with homeopathically imprinted vials that have been essentially energetically imprinted with the same resonance as certain enzymes in the body and different things like that. And I see Dr. Ward trying to join here, and I've accepted the join, so I'm not quite sure why it's not allowing him on. So give me one moment while I just deal with technology here. It says unable to join. Strange. Try one more time. For whatever reason, it's not letting him join. So, oh wait, there we go. Yes.
We got it.
How's it going, Dr. Ward?
Hey, it's good. How are you?
I'm good. Good to see you. Thanks for joining me this evening.
Yeah, thanks for having me.
Absolutely. Well, I'm really excited to hear about some of the stuff that you just learned. I wanted to invite him on because he just spent an entire weekend at the International College of Applied Kinesiology basically conference and learning from a bunch of great practitioners. But I was just about to introduce you, but since you're here, I'm just going to let you introduce yourself. And I told people you've been on here before, but just go ahead, however you'd like to introduce yourself.
Awesome. Yeah, so I'm a holistic chiropractor who does a lot of applied kinesiology, which we're going to talk about more today, in Southwest Florida currently, but I have patients virtually in a lot of different states. I really focus on metabolic health right now, just because diabetes, metabolic syndrome, non-alcoholic fatty liver, it's so common and it's so foundational that when that system gets messed up, a lot of other things get messed up. So I use labs, I use muscle testing, and I use chiropractic, neurological-based chiropractic care to help people recover from those kind of conditions. So
beautiful description. I love that. And Dr. Ward and I know each other because we were in the throes of school together for a long time, and part of a lot of the same clubs, and spent a lot of weekends together outside of school doing our continuing education, because this is not stuff that's taught in school. This is stuff that you study on your own time outside of school to become a better and more thorough practitioner.
Exactly.
So let's start a little bit. I love that you described it as like a neurological approach, because that's totally what it is. And I think people don't always understand that. I was beginning to describe it as using the body as a circuit board, but I'd love to hear your take on it, and then I can kind of add my take. And then if you guys have questions, please throw them in the chat, because this is why we do this stuff. Like, we just want people to know that these things exist and understand how they work and know that they're available to you. So let's start there.
Yeah, so I always tell my new patients, like, when they come in, we're looking for the brain to move to a calm state of being, right? That's the only time when the body will actually heal from any condition. And so by getting the brain there, there's two modes of the brain. It's either calm, rest and digest, parasympathetic, or it's fight or flight. And there's a couple ways to test this, right? So an example for muscle testing, right? I'm looking for whether a muscle is strong or weak. Okay. And basically, if it's strong, you could interpret that as the brain is, it's one way of the brain communicating, and then if it goes weak, it's the brain the other way. Okay. And so for this is the example I always tell my patients. Say you get hit in the head really hard, God forbid, they're going to do a test for your eye. They're going to do a pupillary test. They're going to shine a light in your eye, and they're going to watch the pupil either expand and respond to the light or not, right? If it doesn't, then that means there's a disconnect between the muscle that is your iris, right, in your eye, and the brain. And so that disconnect, that muscle communication system, is exactly what I'm doing in reading and interpreting. But instead of shining a light in your eye 30 times, I'm using an arm muscle or a leg muscle, and I'm seeing how that muscle tone is working to reveal whether the brain is connected and communicating through that muscle or not. And then once you have that set up, basically you can use the muscle testing to be like, okay, does this calm or or dangerously send the brain into a danger signal, right? And once you have that yes or no, you can figure out a lot of different problems based off of the brain and that specific body. So it's a beautiful way. It's basically like, can I ask the body a bunch of yes and no questions? It's like playing 20 questions with the body, right?
Turns the body into a binary code.
Exactly. And so once you do that, it's amazing. You can fix almost anything. And so it's really, really awesome and really cool. And when patients have it done, it kind of blows their mind usually. So
Yep. And I love it because like we both still do a lot of lab testing, and the labs that the conventional system doesn't always run. So we'll do everything from complex metabolic testing to amino acid testing to stool testing to neurotransmitter testing, and I think those labs are incredibly helpful, but they're also kind of expensive sometimes. And so muscle testing is a really nice way to, one, narrow down which labs you want to run because you can figure out what your priority is. And two, you can also use it in the case where someone maybe can't afford to run a lab at that time. So I always like backing it up with those laboratory objective measures, but why not use another tool on top of it? Because you're actually incorporating the patient's body into the care rather than only doing care to someone. And I think it is a much better relationship as a practitioner to do it in partnership rather than as a hierarchy. And I think that's actually really important for healing too, where people don't feel like they're this helpless thing that is at the mercy of everyone above them, and instead they realize that they're a part of their own integrative care and that their body is intelligent and like the body is designed to heal, which is why we should be asking it questions, because every single case is different, every single person is different. And for example, so this is something that I'll do with the skeptics, which I kind of love getting skeptics, because once you start doing this stuff, it's like you can't not feel it. It's just, it works. So if I am working with someone, a really direct like wiring test, most everybody learns this in school, they just don't learn how to apply it, is a muscle test, right? So if I raise my arm right now, I'm using my C5 nerve. If someone pushes down on my arm and it's strong, and then all of a sudden I turn my head to the right and they push down and it's weak, that is a direct wiring test. That means that when I turn my head to the right, something is stressing out the nerve going to my shoulder. So a lot of people come in with shoulder pain and they've had their shoulder worked on a bunch and no one has checked their neck. And so that's just like a direct wiring test, but it's still a circuit board, right? We basically, with turning the head, we inserted a resistor into the circuit. So a resistor in the circuit could also be holding up a vial that's been imprinted with the energy of a virus or a bacteria or a fungus or a certain enzyme in the body. And we can see, like, is hemoglobin A1C stressed out in the system? Is your immune system upregulated? So we can test all these different things and kind of figure out what's going on. And then you can even start to do it with people's thoughts. So if they're thinking about a thought that's stressing their system out, their muscle will respond in the same way, because your thoughts are chemistry and they produce a stress response in the body. And a basic example I'll give people is like, if a boxer's about to throw a punch and then they go and they step on a tack, they're going to lose the strength in their punch because their brain is distracted by the stressful thing. So ultimately, we're just treating it as a circuit board, inserting resistors in the circuit, and then the beauty of it is then you can figure out what relieves the resistor. And this is where we can do some really cool things where we can kind of see, okay, well, does the presence of this herb or this vitamin relieve the stress on that enzyme? Because I think, and I love talking to Dr. Ward because we just think really similarly and it's fun. So most of the time, the way that we think is, what is the body deficient in that's natural, that it needs to run its own processes? And then we can kind of go through and figure out where it's deficient. Or if we do need to use an herbal or something sometime for a little extra help, then we can go there. But a lot of the time I find if I just help the body with its deficient vitamins and minerals and mitochondrial processes, which is like the energy of your cells, it self-resolves a lot of the time. And sometimes it can be removing stressors from the system, like food or toxins and things like that. So I know you like to work with a lot of complex cases. Let's start with, like, what was one of your favorite things that you learned while you were at the conference? And then you can maybe talk about how that applied to a case or something.
Yeah. Okay. So so AK is really focused on the triad of health, right? So the three root cause stressors are structural stress, chemical stress, like nutritional stress, or mental emotional stress. And I have this one case right now. There was this presentation and it was all about basically immune stressors. And so also in AK, in applied kinesiology, it's studying muscles, right? And muscles are on a similar circuit in the body as some organs, right? Just neurologically. So therefore, there's going to be an inherent neurological relationship between certain muscles because they're at a certain level of the spine, and then certain organs, which are also at a certain level of spine, okay? So one of the organs in our body is called the thymus gland, okay? And it's like right here in your chest, kind of above your heart center, right below the sternum. And this thymus gland, it's one of our professors in school used to call it T-cell university, which all that means is that the white blood cells in your body, which are in charge of, eating all the infections, go to school right there in the thymus gland, okay? Well, the muscle in your body related to the thymus gland is the infraspinatus, okay? So it's basically a muscle that helps you go like this with your shoulder. And so if you test that on both sides and they're both weak, that usually means that there is a weakness in the circuit, which is the thymus gland, right? If it was just one weak, oh, it's probably a shoulder injury, maybe a neck adjustment to support that muscle, right? But if both are weak, there's a disconnect in the whole circuit, and it's usually the organ, right? What was super interesting about this, I won't get into a lot of it, but there's T helper 1 and T helper 2 pathways in the body. Okay, basically your body, T helper 1 is more like, you could call it almost like a real problem, like a bacteria, a virus, an infection, right? It's an appropriate immune response. T helper 2, you could almost call it a fake problem or a dramatic problem. It's more of an allergy response. If you're around, like, during virus infections, we heard the word cytokine storm a lot, right? That's an overreaction of the immune system to a real problem. And there's a way to test the muscle, basically, where you can figure out if it's a T helper 1 problem or a T helper 2 problem just with the muscle test. So that was really fascinating. He didn't even use vials for it because I know you can just touch the frequency of the vials. But that was really cool. And so the patient I was thinking of, she has had a lot of health complications since over the past year or two. And she has a lot of neurological signs, like has a hard time walking, has dizziness, also a lot of like bowel stagnation, just a lot of really not fun stuff, right? Sweating at night, like, and everything in me is just like screaming immune system, right? And that's what we're testing for. I'm putting her on different herbs. We're doing chiropractic. She's working with all the medical doctors too, right? But and they're, they tested all her immunity. She was showing up for autoimmunity, things like that. And so anyways, when I was sitting in that presentation, I was like, I'm going to practice this on her. I actually messaged her and I was like, hey, book online an appointment for applied kinesiology because I'm going to do this for you on Tuesday. Because we've managed the case. Like when she goes off her products that I have her on, her symptoms get way worse, right? And I'm doing all this through muscle testing. Yeah, I'm looking at her blood labs too, but they're honestly really not telling me much. They're showing that there's autoimmunity. They're showing me that the T helper 2 pathway is not doing well, right? But they're not telling me exactly what to use or what the root cause is. And so that's where the muscle testing comes in. You can take the lab, you can take the muscle testing and really improve upon it. Anyways, long story short, I'm excited to try that technique on her. I just learned it. So we'll see how it goes. We'll have to update you guys. But that's pretty cool. We're just like intelligently knowing the acupuncture of the body, the meridians, the neurolymphatic points, the organ referral patterns, and then the muscles, using all that information, creatively weaving it together to ask the body questions is amazing. And so again, I was just mind blown. I was like, this is awesome. I'm so glad I'm in this specific technique of healthcare because it's beautiful. It takes a lot of memorization and work, but it's awesome. So that's what I'm going to do on tomorrow. So we'll let you know.
I love that. That's awesome. And this is where I think applied kinesiology has such a great place in care, is like those people where you run all the labs and everything looks normal, but they're still not okay. This is how you can really drill down and kind of figure out what's going on, because it's just a more sensitive approach where you can kind of figure out if something is stressing the system before it's showing up fully as dysfunction. So it's like it's catching things in the very early stages so that we can use it preventatively to help people not reach the state of needing a full-on autoimmune diagnosis, right? Yeah. So yeah, go ahead.
What was interesting about this case too was early on I was suspicious of Lyme disease because it was such a bizarre neurological presentation, yet no obvious history of any neurological injury. And if you don't know about Lyme disease, it usually attacks the brain or the central nervous system. And so with my vial testing, bacterial infection kept coming up, and Lyme disease is a bacterial infection. And so I kept putting her on different herbs that supported that, right? Well, you know, it's been over the course of several months. And last time she went and got tested, she did come back Lyme positive. She didn't at first, which is usually what happens with Lyme because it's so good at hiding, it won't show up on a blood test. But as you kind of poke it and aggravate it with herbs and things like that, then it'll start to show. And that's exactly what happened. So again, just a testament to the power of muscle testing and vial testing and frequency medicine. You'll catch it a lot of times before the labs do.
Yep. And I believe it was Nikola Tesla who said, like, or even Einstein, the future of medicine will be frequency.
Yep.
So understanding frequency is huge, and we are all made of frequency. That's just physics. That's the laws of physics, like your atoms and your electrons that make you up as a organic or non-organic material being are made of frequency. And
Right.
like, that's just how things work. And so if you can start to understand frequency and you can affect or alter the frequency of something, you actually alter the matter. And then that dives down like a whole other rabbit hole of why meditation matters, is like, and why meditation in a lot of cases can actually really help to heal illnesses, is because you are using your brain, which is basically a giant frequency emitter. Your thoughts are frequency. You're using your brain to change the frequency of your body and change the chemical output. Like, your brain is the greatest pharmacy you will ever have. And there's crazy amounts of cases of people healing without even using supplements or remedies or anything like that, but they can help you along the way. And then I'll even find interesting things in cases where when people start to work, like, I'll have them on a protocol of supplements and they'll be doing well. And then as they start to work on their own energy, or they meditate, or they work through some of their emotional stuff, they won't call for the supplements as much.
Yep, so true. So that kind of was something else that was really cool for me being at the conference again, because again, the triad of health, you know, structural, chemical, emotional. And I kind of have just not worked on emotionally clearing my patients as much from the emotional stressors. There's a technique called neuro-emotional technique. I'm not certified, but I had a mentor teach me the basics of it. And so I was checking that on a lot of my patients today, and everyone was showing up for emotion, right? And it is true, when you clear that emotional stressor, and it doesn't mean that we're like having a talk therapy session, right? It's just helping the brain bring the emotion to the forefront, neurologically process it, so it's no longer noise in the background or stress in an organ, right? And so when you encourage the brain to do that, then there's more bandwidth. You need maybe you don't need to get adjusted 3 times a week anymore, or maybe you don't need to take 12 supplements a day, you know? So just to affirm you that, yeah, that was I was like, oh yeah, I was kind of accidentally neglecting that triad, and it's so important to just help patients, you know, get more bang for their buck, really, too. So
yep, absolutely. And the reason I was not at the conference with Dr. Jared is because I was actually at a different conference studying emotional stuff. So
awesome.
I was learning a technique that uses muscle testing called Psych K, and it is similar but different from neuro-emotional technique. And I really like the simplicity of it.
Cool.
But very much, you're not a practitioner doing something to a patient. You are a facilitator working in partnership with the patient so that they can explore their own subconscious, and you are just using muscle testing to help them work through it. And it's pretty fascinating. And, you know, and just working on these things in myself and then talking to a patient is interesting to see the changes in myself and the changes for the people in the course. And, you know, it's basically kind of bringing up a concept or bringing up a stressor, and then using some techniques to eliminate that stressor or bring the stress level down. And then you can also go through like certain statements and see if their subconscious is in agreement with a statement that their conscious mind might think they're in agreement with, but their subconscious and their biology is not in agreement with. And then you're working on clearing that out. And then there's even other interesting ways that you can kind of figure out if there's like a message their body is trying to send them. And, you know, I absolutely work in collaboration with counselors and therapists, and I love doing that, and I think it's really important. But sometimes some people need something different, where it's like sometimes you can't talk your way out of something consciously. Sometimes you have to bring something that's hidden in the subconscious mind to the forefront. Then once it's in the conscious mind, you can talk about it. Right. But if you find that you're just like talking in circles, it may mean like something's getting missed. So that's where these techniques can be really cool. And, you know, I saw a couple questions, like someone was asking, can we do anything around spinal viral meningitis? Sure, it's a viral infection. So it's working with the body's immune system, seeing what you're deficient in, seeing how we can support the body's natural processes. I think something that is a little bit different in holistic medicine versus conventional medicine is often really focused on pathology and killing things, which has its place, but holistic medicine is a lot more focused on supporting your body's natural immune mechanisms and supporting just all of its natural functions, which is why there's so much biochemistry involved in like really like good holistic medicine. Is just understanding the biochemistry of the system, understanding what nutrients are needed for certain enzymatic processes to happen, and then figuring out which enzymatic processes are inhibited and what nutrients to give to facilitate those processes. Let me just see if there's any other questions here. And I just saw another one that said, you know, older friend was presented with dementia and was also tested positive for Lyme and for herpes, which, you know, all of these conditions, infections, and all these things absolutely affect your neurology. And I know Dr. Jared and I agree on like how big of a role the gut plays in brain health. And if you have an infection, it usually means that your body is stressed. Our body should be able to take care of these things, even Lyme. Like our body is designed to clear these. But if you're dealing with a ton of emotional stress, and then let's say you also happen to get injured, and then let's say you're eating your standard American diet, finally it just kind of compounds to be too much for your body, and then it can't really get rid of the infection, and then your immune system's lower, so you get like another weird infection. And that's how we kind of can somersault down these weird pathways. And I know you work a lot with metabolic conditions. You want to talk a little bit about the cascade of the metabolic cycle?
Yeah, I mean, so basically, in terms of in the metabolic cycle, I mean, the standard American diet, everyone is on a road to diabetes right now, like unless you're being really countercultural. The University of North Carolina came out with a study, I think it was in 2019, 2018. 88% of US adults are not metabolically healthy, right? And so what that means is basically you're on the road to diabetes. If you can't handle insulin, if you can't handle blood sugar in a healthy way, that just starts the cascade of a lot of inflammatory conditions, right? So cardiovascular disease, heart attack, heart disease, you know, all these different things. So it's super important that we get control of that system, you know, and that involves cellular health, cellular membrane health, mitochondrial health. And so as we repair those, as we stimulate the body, I mean, we always talk about, one of my mentors, Dr. Mindy, she would always talk about you're either a fat burner or a sugar burner, right? And you should be able to do both and switch back and forth. But so many of us, because of the standard American diet, we're stuck in the sugar burner. And we can't switch back to the fat burner without feeling really sick because we just haven't used it. Use it or lose it, right? And so a lot with these types of, what's so fascinating about it is that it's so easy to fix. It's so easy to fix if you just commit, do it, we can get it done, right? And that's what's beautiful about the body. Remove the interference, simplify it, and the body heals itself, right? Not to like make it oversimplify it. Of course, it takes work. Of course, it might be hard. There are exceptions, but type 2 diabetes especially is reversible. I talk about this case all the time because it was really bad, high hemoglobin A1C. And we reversed it in 3 months because she worked so hard, and it was so cool, you know, with pre and post blood testing. With that one, we didn't even really have to do a lot of muscle testing. But with another patient, we did the same program. She started reacting to some of the protocol, right? And so then that's when I pull out the big guns, the muscle testing, and then we start muscle testing the supplements. And some of the supplements that we were using, it was actually a keto shake. It had a little bit too much stevia in it, which was triggering an alarm system in her body and irritating her. So that's where it's cool. If you have both, you can figure out, oh, okay, yeah, this supplement on the books is really good, but for this patient, it wasn't, right? So that was pretty cool. And yeah, so I'm just really enjoying it because it's so fast. People start losing weight because you focus on fixing the insides, and then it just, you get healthy from the inside out, right? In chiropractic school, we always talked about above, down, inside out, because brain flow and then inside out for the health. And that's how human health works. So yeah, I love the metabolic cases because they're rewarding, they're fast, people are pumped. I mean, they get off of their metformin, right? It's pretty awesome. So
it is really fun. And I just saw someone, now the comments are coming in, so we have some fun questions to answer. I love this. So someone asked, like, have you heard that 1 meal a day is sufficient and 3 is too much? My answer, always, it depends.
Yep.
So yes, always it depends. If you are someone who tends to run high anxiety and high stress, 1 meal a day is probably not the best thing for you. And intermittent fasting is probably not the best thing for you. It depends on the person and how you feel. But a lot of people can't differentiate true energy from wired.
Right.
And if you're wired, it means that you're really taxing your adrenals. So if you just tend to run kind of high stress, intermittent fasting is probably not the best for you, because it probably means you're going to deplete your adrenals, which means you'll deplete your sex hormones, which means you'll deplete your thyroid hormone as well. And so it just kind of really taxes your whole system, but it does it slowly over time. So you can be doing this for a while thinking it's a really good thing. And I've done this before where I'm like, I have great energy, but you're kind of like, it's kind of zipping back and forth, or you kind of get that like squirrel syndrome, right? Where you're like energized, but you can't stay clearly focused. That's kind of that wired sensation. And if you're in that, that means that you're pushing your adrenals really hard. And if you're doing that and you're doing strenuous exercise, now that's kind of a recipe for adrenal fatigue. And then like 1 to 5 years later, all of a sudden your system kind of crashes, or you kind of have an autoimmune thing, or you're like just not feeling well, or you get injured a lot. You can't figure out what's going on. Yep. Adrenal fatigue is commonly associated with injuries. Like it just makes your ligaments weaker. It's one of the tests that we do. Like if I stretch your ligaments and then your muscles go weak, it means your adrenals are tired. Even like the pupillary test that Dr. Jared was talking about. If your pupil can't hold a contraction, that means that your stress system is not responding in a really good way. So if someone is tending to struggle with these things, or they've been on the fatigued side, or they've been on the overstressed side, I actually encourage them to eat smaller meals more frequently throughout the day, preferably with protein, to keep their blood sugar level. And like, you can be thin and have issues with blood sugar. So it's not a weight thing. It is a how are your adrenals functioning thing. How's your liver functioning kind of thing. And then someone also asked about complex regional pain syndrome, which I find super interesting, but I like that smile. So if you have a thought on that, go for it.
I've heard of this one before, but I haven't honestly looked into this specific diagnosis. Here's what I would do if you came into my office, okay? I would do, first I would check out, this is actually something I wanted to talk about too, so I'm glad it came up.
Perfect.
There is neurological injury pattern, right? And I'm not going to use the words, here's the thing too, like when I'm on a podcast, I speak or an interview, right? I speak in generalities. I'm not trying to disrespect someone's diagnosis or things like that, but I'm thinking, okay, this diagnosis and this diagnosis, let's talk about inflammatory bowel disease or ulcerative colitis, right? The root cause could still be an infection for both of those things, right? So I'm not avoiding the diagnosis, but I'm just trying to think a little deeper, right? So with complex regional pain syndrome or something like this, right, there's a few things we want to look at, right? Is there, if you have a bad, like, I assume this is a history of injury in the area because of traumatized.
Badly damaged foot nerve pain from a triggered sympathetic nerve.
Right. So here's what I would do. There's a technique in applied kinesiology called injury recall technique. Okay. Basically, this is a way, whenever you're injured, there are two mechanisms, right? There's pain and movement. Okay. Pain or you could say, proprioceptive input. But basically the brain gets overloaded so much by those two senses that now it's almost like there's an imprint of that specific occurrence in the brain and it can't let it go. And so it's going to constantly view the foot or whatever it is as being in a state of injury because the brain almost has like neurological PTSD from that incident. And so injury recall technique is a way of basically stimulating movement, rubbing over the area of injury to basically elicit pain or stimulate those receptors, and then forcing the brain to be like, oh wait, it's almost like making it kind of live through it again so that it gives it another chance to process it.
In a safe
state.
I've had
what?
In a safe state.
Yeah, in a safe state where you're not being, it's not happening again. And so when you do that, a lot of times the brain can then let go and it's no longer in fight or flight, and it can go into sympathetic and be like, oh, that's not happening anymore. I'm safe. Okay, I'm going to devote more of my resources to actually healing this problem. Yeah, he says it was a car crash from head-on crash going 60 and they were going 60 miles per hour and the foot was trapped, but I survived. So, of course, there's also the extent where sometimes it's just so badly mangled, it's going to be badly mangled, right? Just to put it bluntly. But there is that neurological pattern where there's pain receptors in the brain and then there's pain receptors in the nerves. And we have to clear that fuzziness and PTSD from both of those things and see if we can get some progress.
Yep, I totally agree. And then I'll just give like a slightly different example. So if that person came into my office, I would be asking about that history. So I'd find out about the accident. To
Mm-hmm.
me, like there's totally emotional stuff there. Are you kidding me? That's
Mm-hmm.
a really intense accident.
Right.
So not only would I definitely do everything Dr. Jared was just talking about, in Colorado, I actually also do dry needling as a chiropractor, which is pretty cool because it's a way to kind of retrain muscles and retrain nerves and break up like scars and fascial stuff. I finally got certified after I had a really great PT that did wonders on my knee and allowed me to avoid surgery. And he broke up scar tissue that like everyone else had missed. And so
That's
breaking up,
awesome.
yeah, breaking up scar tissue is such an important thing so that things can flow and move.
Mm-hmm.
The other fascinating thing I have seen with complex regional pain syndrome, I had a 12-year-old girl who had it in her feet, came out of nowhere. Like there wasn't even really an injury, and this was just a common thing. But she like moved with her family and had some traumatic things happen, and blah blah blah. And she was a really chipper girl, and I think it kind of showed up to me that she was, kind of the peacekeeper during a lot of stuff. So I think she was storing it in her body. And I did this technique that I do, which it's called associative awareness technique, and it kind of helps the body enter a meditative state through touch. And as soon as I got her into that meditative state, I could massage her feet and rub them, whereas before she couldn't even touch her own feet. As soon as she came out of it, then she couldn't really touch her feet again. We did this a couple times and she was improving. The other super interesting thing with that one is the pain was gone when she put on a virtual reality headset.
Hmm.
That tells me a ton of it is in the brain. And then I have other people that I work with who use those kinds of biohacking technologies. So this is why I love collaborating with other practitioners. It's like we all do different things and have different benefits, and I'll do some of my magic, they'll do some of theirs, and we'll share back and forth and then communicate, which is like the thing that's totally lost between practitioners these days. So that's just kind of how I'd approach that, in addition to checking in with your body about your diet. And are you eating foods that are inflammatory to you? And is that preventing your healing because your immune system is on because you're sensitive to dairy? And you didn't know that you were sensitive to dairy, because a lot of people also don't know after you get a major injury, you tend to develop some food sensitivities because when you get injured, you develop leaky gut.
Yep.
And that is just a component of the inflammatory process and how your body heals. So all of a sudden, you can have some big injury and then have a food sensitivity that you never had before. That happened to me. I got injured and all of a sudden had a dairy sensitivity. And like, it's because I was eating dairy during the time that I was injured. And then my body was associating it with inflammation and injured tissues. So then you can start to sort of remove those inflammatory things for a while, allow the body to heal, work on gut health, work on healing the injury. And then you can start to bring them back in addition to addressing the emotional stuff. And emotional stuff, when I was doing my Psych K training, I was texting a patient just like you, being like, I want you to work on these things because we're going to do this together, like when I get back.
Yeah.
And and she's been struggling a lot where she's just like super sensitive, like can't even take magnesium, has dealt with like some mold exposures and some other crazy stuff. So she's been through the ringer with practitioners because they all want to put her on stuff, but she can't take anything. And so we've been very slowly working with like some really gentle stuff like salt water, which is actually a really good antioxidant and helps the body like decrease inflammation. And we're just starting there with her body. But I've known that she's had some emotional stuff kind of stuck. And so I told her that I wanted to do this thing. And she's like, actually, I just went and saw this other practitioner and she did some emotional work on me. And my shoulder hasn't hurt since. And like she'd been dealing with this like upper shoulder pain for a while. So just from the energy work, all of a sudden, and this is someone who comes from a conventional system, so this was totally new for her.
Right.
But she was open to it, she tried it, and she's been feeling immensely better, and now she can actually take the magnesium just from doing that like one little emotional, energetic clearing with someone. So this is where we get into the holism of things, right? Like holistic means looking at all of this stuff.
Awesome.
And then there's another question about tinnitus.
Oh, like helping people with tinnitus?
Yeah.
Okay, yeah, so I'll just speak what I think about it. So there's again, structural and chemical is where I usually go in my brain first. So most of the cases of tinnitus I've seen have happened post-viral infection. the reason why I would say that is because whenever there's an infection in the body, the lymphatic system gets really engaged, right? And there's a specific part of the lymphatic system in the brain called the glymphatic system. And this goes by the inner ear, drainage in the brain, et cetera, et cetera. This also gets really overwhelmed and overcrowded with people with Lyme disease or other, mold exposures, things like that. And when there's a lot of inflammation in that region, it shows up as irritability, things like that. So most of the time with tinnitus, it can be really stubborn because it's not easy to fix. It's not like it's not formulaic. But basically then I'm just going to start looking at, okay, how can we support these patients' drainage pathways? Are they having regular bowel movements? Are they moving? Are they sweating, right? Are they detoxing? And then an herb I like for just supporting the lymphatics and the immune system in general is echinacea. It's very immune modulating. So I'll see some success with that, just calming down the inflammation and stimulating lymphatic health in the body.
Also, we just want to tell you guys that none of this is medical advice. We are talking theoretically, and we absolutely want you to speak with your practitioner before engaging with any of this.
Yes, thank you for that. So in generality, that's what I'll test on people when they're in a meeting, in an appointment with me. So that can be helpful, but yeah. And then also structural, okay? A chronic misalignment in the neck called a subluxation has a negative effect on the brain flow to the body, blood flow to the brain, and lymphatic drainage going through the neck. So if there's a misalignment, like a structural misalignment in the neck, that can just cause a buildup of fluid abnormality that creates that tinnitus sensation in the inner ear.
Yep, absolutely. And honestly, I'd approach it really similarly. I'd also definitely approach diet and looking at things like that because I find it's commonly tied to inflammation of some sort. And so, in general, if I talk about the way I approach things in functional medicine, it's look for the inflammation, see if it's an infection, see if it's a toxin exposure, mitigate the inflammation, work on healing the tissues and supporting the body, and then getting the body to a resilient state, and then hopefully you can bring those foods back in again, and just listening to the body, which is a lot of what I teach people about. Like, I finally developed online courses for this because I got these questions so much, and I realized most people can resolve a lot of stuff if I just teach them how to listen to their body, which somehow has totally escaped healthcare. So in those courses, I know, right? In those courses, I teach you different things that can pop up and what your body is saying when this happens or when this happens, and when to ask your practitioner questions about this or this. So I developed that because these questions come up so much and because I think it's so important. And then I had someone else ask, this is a good question, do you ever think of prescriptions as a solution, as a stopgap until you get your health back? So I know that Dr. Jared and myself kind of feel similarly on this, where they have their place. But in general, we try to use them as a last resort. And however, for example, I have a client who has terrible ulcerative colitis, came to me because they've been everywhere else and tried everything and are basically just trying to avoid surgery. Now, we were trying to work with some supplements, but he again was one of those patients who's just sensitive to everything. But he's really good at listening to his body, and I encourage him to listen to his body, and I will make suggestions, and then if his body reacts in some way, he alters our suggestions based on how he's feeling, and then writes me about what's happening, and then I get back to him, and then we modify as we go. So we've been changing things up and down all the time depending on how his body reacts. Now, his other practitioner that he's working with, that we're working in collaboration with, put him on some prednisone just to get some of the inflammation down because he'd had a huge mold exposure in his apartment that he's getting remediated. It's amazing how many people have mold, and I don't necessarily think of mold as the ultimate problem. I think of it as gasoline on whatever fire you already have.
Right.
So it's we have to chill out the gasoline, and then we have to address the fire, and then you should be able to handle mold like any other person, hopefully. But once you have an immune response to something, you just have a tendency to be more sensitive to it anyway. But with him, his practitioner put him on prednisone. It got his inflammation down a lot, and then I was able to work with other natural anti-inflammatories that he definitely needed, like fish oils and pro-resolving mediators and gentle things like that. A lot of people think of turmeric as a really great anti-inflammatory, and it is, unless you're highly sensitive, and especially if you're having histamine reactions, because turmeric is a histamine food, and if you put histamine on a histamine reaction, it's going to flare it. So that's not the right anti-inflammatory for him. So there's different kinds of anti-inflammatories for different situations. But that prescription allowed us to make some progress and kind of help his system turn over a little bit so that we could stop the tissue damage long enough that we could help his immune system chill out, and now we can actually make some more progress. So that's a time when it totally came in handy. And yes, like I absolutely think there's a time and a place for them. I also think they're highly overused. And
Right.
I think approaching things naturally first is a really good way to go, because you can often resolve it. And I'll
Right.
let you speak to your thoughts on that.
No, yeah, I totally agree. I think prescriptions are a helpful support until you can restore health. The thing is, most of the time, prescriptions are prescribed to be on for the rest of your life, at a higher dose than was initially intended. You know, for example, like omeprazole, which is a common antacid that a lot of people are on. It was only intended to be on it for about 2 weeks. You know, and so if I recall correctly, and most of my patients who are on that have been on it for a very long time, months if not years, right? And so the problem is not prescriptions. The problem is the way in which they're being used. A lot of times, I say so, and then a lot of times with heavy Lyme cases, Lyme disease, antibiotics are great. They're super helpful, you know, at some points. And so it's just about not overusing prescriptions and not relying on them for the rest of your life. So, and I would say the same thing with herbs. You know, there are some herbs I think that would greatly benefit people to be on for the rest of their life, but there are others that you shouldn't be on forever. You know, so it just depends.
Yep, absolutely. And you know, all prescriptions, as well intended as they are, have their own side effects, just like supplements too. Like
Right.
N-acetylcysteine is amazing. It is a precursor to glutathione. It's also a biofilm disruptor, helped a lot of your cellular processes. If you have genetics that make you sulfur sensitive, it's not idyllic for you because it contains sulfur. So it works for some people, not for other people.
Mm,
And so this is where muscle testing can be so helpful, is we can kind of figure out like what works for you, what doesn't work for you, why does what works for your friend not work for you, why does what works for your family member not work for you. And so I think Dr. Jared and I just tend to get a lot of those patients that have just been all over the place.
mhm.
And I find just a lot of muscle testing practitioners tend to get those patients because it's such detective work, and
Yeah.
it's such a diligent way of going through the body and like listening to the body, which I think is also something that's been really lost in healthcare. It's just kind of turned into a really big guessing game based on only labs, and labs are great, but also like there's weird things where you can have something show up high on a lab and then it won't muscle test weak, which means that even though it's showing up high, it's not the priority to fix, and there's
Yep.
actually something else that needs to be fixed. um, and then we'll do one more question as we tend to wrap up here, because I know it's a little bit late there and you've had a long weekend. So this is a good one to end with, actually. What are ways to quiet the brain to help with mental breakdown? And I think there's a lot of different ways to do it. Some of the emotional techniques that we were talking about are ways that you can
Mhm.
work with a practitioner on it, because I know sometimes, I mean, again, I'm always an advocate for finding a therapist that's a good fit, because that's the trick. You got to find someone that you resonate with, and you got to go shopping. And same thing with practitioners, like
Mhm.
shop around until you find someone you like, and someone that is on your same level, and someone that doesn't dismiss you, and someone that doesn't make you feel stupid. I think that's a really important qualifier for practitioners, like someone who works with you and is kind and is supportive. But you can work with counselors, but sometimes, again, if you get talking in that circle and you feel like you're a little bit stuck, that's where the other techniques we were talking about, like neuroemotional technique or Psych K or something like that, can come in. And then meditation is another way. And I talk to people about meditation all the time, and they're like, well, I'm not doing it right because my brain just like won't shut up when I sit down. And I'm like, well, are you aware of it? And I'm like, yeah. Are you catching yourself doing it? Yeah. Well, that's meditation. Like, it is allowing your brain time to discharge. And I think of it as like a bodily function, right? Like, we have to void our bowel, we have to void our bladder for our health. You also have to void your mind of waste. So sitting there in the quiet and letting it just kind of run through all its thoughts without judging them or without trying to change them, and then coming back to a state of being centered and focusing on an emotion that you want to have, like peace, like imagining. I know, like, maybe you haven't felt it in 10 years, but with your imagination, like, what would peace feel like in your body? Maybe it would feel like relief. Maybe it would feel like setting a heavy backpack down on the floor that you've been carrying forever for just a couple minutes, because the world will not go into chaos if you disappear for 10 minutes. And just starting to work with things like that. And no, there are tons of different kinds of meditation. And it's just about exploring and finding things that are good for you. And it's more about consistency than duration. So if you can just start practicing even 5 minutes a day, every single day, and then work your way up, slowly over time, it'll get easier and easier to do longer durations. And I am at the point now where I try to do about an hour a day, because I find for myself, it takes my brain 20 minutes to just chill out and for me to actually like be centered in my body, because I'm a thinker. It's just how my mind works, and I've just learned this about myself. And then I spend like the next 20 minutes kind of expanding myself and exploring, and then I spend the next 20 minutes just sitting in that kind of open space where I've kind of forgotten that I exist as a person. And there's different exercises that you can do, like you can go back and do like childhood meditations or whatever if you're working on something specific. And I actually have meditations that I give to clients. So if anyone is interested and you want to check those out, just comment below and I'm happy to share those resources with you. And then there are apps like Insight Timer, and it has tons of resources for meditation or emotional exploration, but you have to emotionally discharge. Like, yes, there's focusing on the future and focusing on the emotion that you want to have, but you also can't just like ignore your emotions and suppress them, because then that turns into chemistry in your body. But I'll let Dr. Jared give his thoughts on quieting the mind too.
Yeah, a great thought on meditation and emotional regulation. I had one case comes to mind. I had a patient who served in the Navy for 10 years, had a lot of PTSD, right? Just a lot of mental turmoil, had panic attacks, things like that. He also happened to have GERD, so a little bit of heartburn, acid reflux, so there was a gut-brain connection probably going on as well. So kind of the perfect storm for just mental unrest, right? And so with him, we really focused on, again, in his mental emotional life, just practicing feelings of safety, things like that. And then I also gave him a product that was a lot of minerals. So a lot of times when there's a lot of mental health stress or emotional stress, the body and the nervous system burns up minerals a lot faster than it should be, and then it's almost like running off of fumes, which makes the problem worse. And so when we did the mineral supplement and started working with the gut health, he didn't have another panic attack. So that was pretty awesome. Can't guarantee those results for everybody, but that was really cool. Just, applying the basics of human physiology and mental health, and to really help improve that. So there's a lot of things you can do. So hopefully you all have someone in your corner that can help you. If not, I know Dr. Christine or I could as well. So, and we have lots of friends too, so that could probably help. So
Absolutely. And the last thing I'll say that I think is really important for mental health that everyone skips is body work. Like, go have someone work on your physical body. Like, we consider it a luxury when people maintain their cars more than their body. Like, please go get some body work. Go get a massage, go see your chiropractor, go see your acupuncturist. It helps to calm the brain and balance it out with the body. So anyway, thanks, Dr. Jared. This was awesome. I always
yeah,
love
it's
chatting
great.
with you, and we'll have to do more of these, because I think there's a lot of questions that came up, and I think just this, like, if this came into my office, this is what I'd think about, is a really great way to kind of expand people's minds to
Yeah,
what is
I like it.
available to them. Totally. Well,
Thank
if
you for
anyone
having me.
has
Appreciate it.
Oh, absolutely. And if anyone has any questions, feel free to message either Dr. Jared or myself. You can just click on our names and message us on Instagram. Feel free to comment on the video. I'll post the recording to my channel after this. And yeah, we just do this for you guys, and we just want you to be happy and healthy and have the resources that you need. So much love, and get some good sleep tonight, because it's important for your health. And we'll see you again soon.
Yep. Bye, guys.